All right, welcome back. This is Clinical Informatics with Kenji, and today we'll be talking the continuation of cybersecurity in healthcare. And we'll be specifically focusing on the laws impacting cybersecurity in healthcare. All right, so let's get into it. All right, so these are the five laws that we'll be talking about today. It kind of looks intimidating. I know it's not the most exciting topic, but this should allow you to gain knowledge to protect yourself and your patients as well. And by knowing the laws, you won't accidentally break it, hopefully. And by knowing the laws, you can innovate under the law safely. So I think it is important to know. All right, let's get started. So the first law is the Federal Trade Commission Act in 1914. You might think like, why is the FTC, the Federal Trade Commission, involved in healthcare? Well, in Section 5, it mentions the prohibition of unfair or deceptive act or practices in or affecting commerce, and they see healthcare as a commerce. So they kind of act like the guardian of the market. They keep competition fair, they stop the monopoly, and monitor deceptive businesses. They also protect consumers from false ads and make sure providers are protecting consumers' privacy and that they are truthful about the degree of privacy. For example, in 2016, a dental software company was investigated by the FTC and they were charged for falsely uh, proclaiming that their product is secure. So the FTC fined them for not being truthful about the degree of their privacy for the customers. The next law is the Computer Fraud and Abuse Act of 1986. This was initially limited to the jurisdiction on federal computers and certain financial institutions and interstate crimes. But because of its broad language use and therefore there's a wide range of interpretation. For example, uh, it monitors unauthorized access to obtain information or damage of the information. It also monitors computer espionage, spying. The flip side of the coin is that the CFAA prohibits companies from hacking back or aggressively pursuing perpetrators. So, uh, the Hobblobby code doesn't apply here. Uh, eye for eye, code for code, hacking for hacking, that doesn't apply here. Uh, if you are hacked, you got to uh, hold your horses and not hack back, potentially because you might harm somebody that you didn't intend to. So uh, don't hack back, even if you are hacked. And the next law is Cybersecurity Act of 2015. It was enacted to improve cybersecurity in the US through enhanced sharing of information about the threats. In healthcare, the Department of Health and Human Services, the HHS, was tasked to provide a report to Congress about cybersecurity readiness and risk assessments. Also, the act encouraged a healthcare organization to adopt framework developed by the NIST. So this helped to standardize cybersecurity. And then the mother of all privacy law, the HIPAA, the Health Insurance Portability and Accountability Act of 1996. This is a big law, but we're going to just focus on the cybersecurity perspective of it. The Act set privacy and security of patient information and defined civil penalties for failure to comply with regulations. In 2000, HHS published the Privacy Rule, which defined the individually identifiable health information as protected health information. And then in 2003, HHS published the Security Rule that protects the ePHI, the electronic PHI. And regarding the security rule a little bit more, the HIPAA did not define specific standards to adopt, but the general rule were to maintain reasonable and appropriate administrative, technical, and physical safeguards for protection of EPHI. For example, in terms of administrative safeguard, risk analysis, document vulnerability, mitigation plan and implementation, and limit access to EPHI, designate security officials, and provide training for those who are accessing the data. And physical and technical safeguard to limit facility and workstation access, uh, audit to look for unauthorized EPHI access, ensure EPHI is not improperly destroyed, and to protect EPHI transfer over networks. So failure to do these, failure to follow these rules would lead to a hefty civil penalties. And then finally, the Gramm-Leach-Bliley law, uh, also known as Financial Service Modernization Act. It was intended for financial institutions to explain their data sharing practices to consumer and safeguard information. However, now it applies to healthcare systems as well. In terms of privacy rule, health system must notify patient of their privacy policy. Patient must be given the option to opt in or opt out. And the safeguard rule, it must have a program in place to protect the non-public personal information, the NPI. And the pretexting rule, it must have a program to mitigate outside cyber attack that tries to obtain NPI. All right, so that's the end of this video. Uh, I know law is not the most exciting topic to talk about, but I hope from this video that you got some idea of why it's there and how it's protecting us. And by knowing it, we could protect ourselves from accidentally breaking the laws. So in the next video, I'll talk a little bit more about few laws surrounding cybersecurity in healthcare. So not the most exciting topic to talk about, but I'll try to make these laws very concise and deliver it to you guys. So hope to see you guys in the next video. Thank you for listening. Goodbye.